And Dr. Timothy Quinn practices family medicine in Ridgeland, Mississippi, with more than 18 years in private practice. He's joining us now. Doctor, welcome. Thanks for being on Prime this Sunday. As of July 29th, nearly 4.2 million children have tested positive, almost 72,000 in 1 week alone. That's according to the American Academy of Pediatrics. What are we learning about COVID in children?
Well, what we're learning right now is COVID is definitely, especially this Delta variant, is much more infectious, meaning that if you're around someone and they have coronavirus with the Delta variant, the CDC just released information that's saying it's greater than twice as infectious, meaning you have twice the chance of contracting this new Delta variant. And what's going on is our children, well, if they're less than 12 years old, they're not even eligible for vaccination, so they've not been vaccinated. But if they're 12 or older, they can get the Pfizer. But right now, this move is very slow in the United States, so a lot of our children are unvaccinated and they're vulnerable. And now we have this Delta variant that's so much more infectious. So we're seeing just a rise in children getting infected. There was a report in Louisiana that said 1 in 4 children are testing positive right now, and so many children are being hospitalized. So we just have to really be on the lookout and just really encourage children that are 12 and older to get vaccinated, and we need our children to wear those masks.
Yeah, we just heard Felicia's story. The government and healthcare professionals, they've tried for months to use persuasion and education to get people vaccinated. A lot of employers, including federal government employers, the federal government workers, are now mandated basically to use a stick instead of a carrot. Is it time, in your opinion, to start mandating vaccines?
Well, I've talked to a lot of my colleagues, my attorney colleagues, and a lot of my professional colleagues in the medical field as well. Now, a lot of hospitals and healthcare organizations are starting to mandate. And what they're doing is they're using a mechanism as far as a legal mechanism called bona fide occupational qualification. And with this mechanism, they can use this in a court of law, saying that the employee has to be able to perform the job function. And an example that I was given was the military. In the military, you have to be able to pass a physical fitness test, or you won't be able to perform the job function, which is to protect the country, the United States, or whatever military you're in. But at the end of the day, if you work in a hospital, you work in a nursing home, if you're not vaccinated, then you have a higher chance of contracting coronavirus. But even more importantly, you have a higher chance of passing it on to a patient. Maybe it's an elderly person or someone with chronic medical conditions. These are vulnerable people that go to the hospital or to a medical clinic, and they put all their trust in the staff to help them get better. And if they're not vaccinated, then they can actually make them worse, or even worse, they can make them lose their lives. So, you know, right now there's a lot of debate about it, but as time goes on, we'll see more and more healthcare facilities like hospitals mandate vaccinations, especially after they get the full authorization from the FDA, which should be very soon. Because remember, right now we're still under the emergency use authorization, but it's being predicted that they'll get the full authorization as soon as the Labor Day weekend.
Okay, I want to get in booster shots. When can we expect them? How effective will they be?
Well, right now, there's a lot of debate about booster shots. So far, the CDC, the FDA, they've not advised it yet. And what they're looking at is they're looking at all the other countries that might not have access to the vaccines. They're following the lead of the World Health Organization, saying that these countries, we need to allocate some of the vaccines to them. But at the end of the day, a lot of people are concerned because a lot of the research is showing that the booster shots could be very beneficial, especially those that got the Johnson & Johnson shot. With that they're saying that this vaccine was not as effective as the messenger RNA vaccines, such as the Pfizer or Moderna. So right now, in a lot of states, such as Mississippi, I just spoke with the personnel from the Mississippi State Medical Association. We're advising our physicians to have a conversation with our patients, and if it's determined by the physician that the patient would benefit, we'll go ahead and advise our patients to get that booster shot. And in clinics such as mine, we will give them the shot, especially if they're immunocompromised and they're vulnerable, because at the end of the day, it's all about saving lives.
All right, Dr. Quinn, thank you for joining us tonight.
Hey, thank you.